Located just outside of Seattle, Washington, Providence Regional Medical Center Everett is part of Providence Health and Services. It's the third largest not-for-profit health system in the United States. It employs 72,000 to run its facilities in Washington, Oregon, Montana, California, and Alaska. Its main campus in Everett is a major referral center for the northern Puget Sound region. And in 2005, they saw the need to start a patient and family advisory council.
There was actually a medical error that occurred here in our emergency department, and we misdiagnosed an abdominal aortic aneurysm, and the patient passed away.
And so the family members came forward and talked to us at the hospital and had a list of demands, which they had a right to.
One of the demands was to form a council that could oversee patient safety for the hospital because they didn't feel we had that.
At that time, there was a lot of criticism about hospitals being silent, not coming forward, not accepting responsibility, patients were frustrated.
We realized we could do better and that maybe the best approach is really to hear the patient, connect with the patient, understand the patient, and see it from their perspective.
It wasn't one of those things that we had to do by state requirement or by federal requirement. No one said you had to have a council.
But finding the right people to serve on the council is key to its success.
I want critics. I'm looking for someone who is pretty highly critical of the care that we've delivered so that they can drive us to being better.
Volunteers who have a personal connection are a great start for how we look for advisors. We also want people who can contribute constructively and realize that this isn't a blame situation.
We want someone that realizes they're here to help, and we want to be positive, and we can make positive changes.
Providence put out the word that they were searching for volunteers to give their opinions about their healthcare system.
Since I had spent 50-odd years in a drugstore in a country pharmacy, listening to people comment about their stay in the hospital, I thought, that would be good for me.
I saw a flyer for the program, and I'm kind of a doer. And so the idea of getting involved and sort of seeing if we could do it better for other patients was exciting to me. And next thing you know, I was hooked.
Look for the patient complaints and be fearless in having them be in the forums. Be fearless, because we're all trying to make our hospitals better.
The perspective that they bring is eye-opening to many of the clinical staff there, the physicians, the nurses, the pharmacists, and others, because we're seeing care through their eyes. You don't always hear what you want to hear. And so when we ask, it's really important that we're willing to listen and seek to better understand what that perspective is.
At Providence Regional, the Patient and Family Council is just a starting point. It also has a smaller board and committees. The advisors attend hospital meetings as they implement their projects.
The patient family advisors are embedded in almost everything that we do. So the chair of that group sits on our board. We involve advisors in many of our committee structures.
I've been on focus groups here. I'm on several different committees, and of course those are always changing as the need of the hospital is.
We also involve our advisors in physician onboarding. They take our new physicians around on tours. They helped us in terms of developing interview processes for them. They're involved in different patient care programs that we put in place. There's a robust program of about 30 advisors. They're a very active group, and we prize their input.
We're here all the time, and we're willing to help where we can.
Our leadership knows that we're here and that we're an asset. And so it feels like a big responsibility.
That responsibility includes changes to many aspects of the patient experience at Providence Regional, including something as basic as the signage in the hallways.
The print was probably half an inch high and way off in the distance. So they redid the whole signage, and it's great. You can find out where you are now.
It's not just signage that they're putting their mark on. They also advise on how the caregivers interact with their patients.
Another thing they told us, you all tell us you work as a team, but why do we never see you as a team? You'd have doctors rounding in their way, you'd have nurses coming and going in their way, but you would never see them together. So it changed how we round now. We now round with doctors and nurses together so that patients and families can see the team.
And then we did whiteboards in the rooms, and so they could tell who they were being helped with that day.
My name is Hector.
When I was in the hospital and I had open heart surgery, I remember across from me was a board up that said passport to home. And on that they had the doctor's name, the nurse's name, the date, because patients get confused. And down at the bottom it had anticipated discharge date.
When Providence Regional Medical Center built a new $500 million tower, they reached out to the council for insight about the design of the patient areas.
They did a mock-up room, and then we all went in it and critiqued it.
Each room has the imprint of the council on it.
The room is set up in zones. You've got the patient zone, the caregiver zone, and the family member zone.
So the third closest to the door belongs to the staff. It's the sink and the areas for supplies. The middle third belongs to the patient. But the third over by the window belongs to the family. That's their space. And that was very deliberate in the design, and it was done by the council.
One of the things was the windows were glass in the door. So when you walked down the hall, you could look in, which was fine. Except also you saw the bathroom. And the bathroom faced the door on the hall. So we suggested that they turn the bathroom a little bit so that when the patient was in the bathroom, everyone walking down the hall didn't have a lovely view. We thought that was quite logical. We tried all the chairs in the hospital. They chose a different one and they have had to change it because the people kept falling off the end.
Anyone who was involved in that whole project would agree that having our patient and family members making some of those decisions or helping to make some of those decisions was extremely beneficial to the organization.
Over the lifetime of the council, the benefits of their presence is clear.
We work as a team. It's not just the doctor and the patient. It's the doctor, the patient, the nurse, and the family members.
Our board is really excited to have us there. They're really beginning to see the value of our Patient and Family Advisory Council. That's good, and I think that's good to remember that we're here thinking about the people in this room, not just our roles, not just our history and how we got here, but really the people and the humanity. Currently, we're offering them feedback. It's interesting to look around the room and kind of see light bulbs going on in people's heads, and that is sort of worth it, to bring up a challenging question and just see that people are thinking about what that means for all of us moving forward.
We all go into healthcare for a reason, because we want to serve patients. And when we create those connections so that it is a personal connection with the patients that we serve as caregivers, that comes back to us many times full.
I feel like this is my family, and that's the way they treat me here, and that's why I keep coming back.
Our patient satisfaction scores have gone up. Our community's regard for this organization have gone up. The numbers of compliments we get and thank you notes from patients has definitely gone up.
They have found that we do contribute.
I want a patient and family advisor in every meeting to remind us of why we are having those meetings and why we come to work every day.
Any hospital that doesn't start a program is missing out.
It's one of the key components in the puzzle that makes us successful.
I'm Armando Nahum, patient advocate and principal of H2PI. On behalf of VHA, I encourage you to contact us on how you can implement a patient and family advisory council for quality and safety in your facility.